Hello everyone and welcome to another session with PEKGA. Now this week's session is going to be quite different, okay? We're not going to be taking a look at an ECG. We're going to be talking about learning to read and interpret ECGs, about the ECG world in general, and some things you can do to help yourself out. So this video is really for anybody that that has any sort of contact with ECGs. Okay, we're going to be covering a little bit that everybody can benefit from. If you are a newbie, if you are just getting into or you're looking to get into the ECG world, I think this is an excellent video that will kind of help you gauge of what you're getting yourself into. So in this video, we're going to be discussing what a 12-lead ECG is. Now, there's a lot of topics. This is not going to be a deep dive. I really don't want this video to be 4 hours long. So we're just going to take a look at a 12-lead and why it's used, who reads and interprets ECGs, what the difference is between reading and interpretation. We're going to break down these expertise levels, show you a couple of examples. We're also going to reason through these expertise levels. Also, what you can do to learn in advance, and finally, what PEKGA has to offer. So let's get into it. You want to learn ECG interpretation. We're going to talk about what does it really mean and what does it really take. Okay. So ECG is a serious diagnostic tool, and it really is a serious diagnostic tool. Why is it serious? Because medical treatment will be assigned based on ECG findings. So whatever you see on an ECG, right, somebody's going to take that and say this person needs this or that, right? It does require three components. For an ECG to come into being, it does require three components. You need a patient, you need an ECG device, and you're going to need somebody that's going to read or interpret these results. So three components are necessary for what we term an ECG. All right, now you can go into, you need paper, you need this, you need that, you need all of that. But these are three essential components, right? Now, the more advanced the apparatus or the ECG device, right, the more precise the information is going to be. This is referring to, simpler devices that are going to give you a rhythm strip. Maybe they only have a couple of channels, whatever the case is, but the more complex, the more information you're going to be able to pull off of that patient. Now, the more advanced or capable the reader or interpreter, the more accurate the interpretation is going to be. Okay, this kind of goes without say, but let's keep going. Now, reading ECGs is a skill. It really is. Just like any other skill, right? And it can be learned relatively quickly. It will depend on your ability to discern ECG components. So just like any other skill, some people are going to be better at it than others. Some people are going to pick up ECG reading skill more quickly. And for some, you're going to struggle through it. But of course, practice makes perfect. Now, ECG interpretation is a science, okay? And I'll show you why in down the road here. But this requires dedication, it requires learning, and it requires practice. Now, these two terms, reading and interpretation, are often interchanged. Somebody was going to say reading or interpreting versus reading. What's the big deal? You're doing the same thing. It's kind of true, but interpretation, you'll see why I'm splitting them up and individualizing them. Now, interpreting ECGs well is an art form. It really is. This, in my opinion, is a graceful methodological approach fortified with experience and knowledge. Now, for those of you who are reading ECGs, you must have at some point come across somebody somewhere that took an ECG that was just confusing to you. You had no idea what you were looking at, or maybe you had some idea of what you were looking at, and this person just broke it down step by step, explained to you what's going on with such grace that it kind of baffles the mind. All right, now why is a 12 lead used? No, the 12 lead is an industry standard, and for any sort of certification, you're going to need to know how to read a 12 lead ECG. Okay, so if you're out there trying to get certified in something less, it might be something ultra specific, but if you're thinking about working in the industry, just understand that you have to know what a 12 lead ECG is and how to read it and interpret it. In this video, I'm going to be focusing on a 12 lead, right? So 1, 2, 3, 4, 5, 6, and then another 6 over here. That's the 12 leads in the 12 lead ECG. Why a 12 lead? I just mentioned that it's an industry standard, but more than that, a 12 lead ECG can be broken down if you take your limb leads, 1, 2, and 3, your augmented right, left, and foot, you have your frontal plane analysis. So there's a multi-plane depiction really possible on a 12 lead ECG. Now over here, I don't know how easily this can be seen, but excuse me. You have different planes here drawn on this person, silhouette really, right? So here's your frontal plane. That's referring to this over here. And then you have your horizontal plane. You can kind of see it written over here, but that's this horizontal plane, right? That's referring to your chest leads, your precordial leads. So you can be looking at the progression of the signal in two different planes. That's not possible on some of the lower ECGs. I mean, when you have less channels, right? It might be to some extent, but not to the extent that a 12 lead can do. Further than multi-plane, analysis, 12 lead ECG can be broken down into regions. So, for example, you want to take a look at what's going on at the bottom of the heart, the inferior segment of the heart. You take a look at leads 2, 3, and AVF. You want to take a look at what's going on with the lateral segments of the heart. You take a look at leads 1, AVL, 5, and 6, V5 and V6. Right, anterior portion, that sometimes overlaps with the septal, depending on how you want to look at it and what's going on. And then you have your septal region, V1 and V2. Also, this is my favorite lead. This is known as the lone wolf lead, or a high right lead, AVR. And it's worth mentioning most 12 lead ECGs, not all of them, but most 12 lead ECGs are going to have at least an extended view of the long lead, or the most commonly used lead, that's lead 2. So you're going to have 10 seconds laid out over here versus 2.5 up here. Now sometimes you will see 3 leads down here. That's typically V1 and V5 looking at the right and left sides of the heart. This is just a different depiction to illustrate a point why a 12 lead is used. Right here I mentioned we have planes, multi-plane depiction. Here we have regional depiction. And when you take a look at this, right, lead 3, lead AVF, lead 2, that's all looking really at the bottom of the heart. Now the lateral leads over here, right, they're looking at the sides of the heart. Now, if you're looking at this and you're a complete newbie, you don't know anything about ECGs, or you just got into the ECG world, why did I do this when I was talking about lateral views? Because these leads are really looking at transition of the signal from left to right, and you can deduce on this side what's going on this side as well. So you can be inferring what's going on the opposite end. The anterior leads here, and by the way, you can do that with all the leads. When you get into this game and you're talking about STEMIs, you're going to be talking a lot about reciprocal changes, right? The anterior leads are here. They're really looking at the front face of the heart. And then we have our septal leads, V1 and V2. Now, it's not so easy, it's not so obvious, for some of these, why are these septal, why are these anterior, but we're not going to be talking about that today. I just want to show you what a 12 lead can do. And finally, you have your high right lead AVR, which is telling you what the signal is looking like when it's moving either away from it or towards it. This lead gets ignored a lot, but it is my favorite lead, and I think it's extremely useful. Okay, now who all reads ECGs? Of course, physicians, right? Nurses, emergency medical services, technicians, medical assistants, and other unique categories, if you will. Well, stress test is not so unique, and neither is a study, but all of these will be reading ECGs. And there's more. These are just some of the main ones, right? Now, what's the difference between reading and interpreting? Again, these two terms get interchanged quite a bit. And I'll show you there is a difference. There really is a significant difference. So imagine you're reading a book. You picked up a book off of a shelf. I don't know, you were at somebody's house or at the library, and the book was way above your head, right? And I don't know, maybe you picked up a book on quantum physics, right? Now, you're not a physicist, but you can read the grammar, you can read the letters, the words, right? But the context escapes you. That's the difference between reading and interpretation. So if you're reading an ECG, you'll be able to pick off heart rate, individual components, rhythm, and other components necessary for interpretation. Now, the difference is interpretation aids in diagnosis, okay? Reading well may or may not. So just because you can pick out the P wave, the QRS, and so on and so forth, that may or may not help you or somebody else interpret this ECG well. However, interpretation will. When somebody's interpreting ECGs, we're talking here about rhythm proficiency, component proficiency, all of the rhythms, components. We're talking about individual components of an ECG. We're also talking about anatomical and physiological proficiency. That's going to be necessary for interpretation. Again, you need to understand the context. So really, when we're talking about interpretation, you're talking about multi-level assessment. You're going to be bridging concepts such as conduction, physiology, and other ones in order to fully understand what's going on. That being said, any ECG can be read, right? A 12 lead, a 6 lead, a strip, you can read it, and you can identify individual components and label it and leave it for somebody else to interpret. But understanding what you read, the context, that's not so easy. Okay, that requires a lot of things in the background, right? It requires a lot of foundation. The important thing when it comes to interpretation, as you saw that 12 lead, the further away from a 12 lead ECG that you move, so as you're degrading down into 6 leads, 3 leads, single strips, the more difficult it is going to be for you to understand and interpret what is really going on. And if you watch PEKGA videos, I really emphasize that quite a bit. Now, for the purposes of this video, okay, so for the purposes of this video, we've broken down ECG expertise into levels. Okay, no such official gradation exists. This is very important. I'm not trying to tell you that, this is what an expert is, this is what a beginner is. I just want you to kind of get a little bit of understanding of where you are at, what it takes to jump from one level to another, and you'll kind of see what the expectations are in certain fields out there. So this is designed to help you gain perspective and to gauge your progress if you want to. You can just be watching this video to fall asleep, and that's fine. But you can also gauge your progress. We really tried to be objective here when it came to ECG interpretation because it is a serious diagnostic tool. Now, we broke up the expertise into these 4 categories. Again, you will see this broken down in other places into, maybe a lot more categories. But we broke it down into beginner, intermediate, advanced, and expert. Okay. A beginner, again, no such gradation exists, right? So this is for reference only. A beginner is somebody that's still learning. So you just started getting into the ECG world, understanding what an ECG is, how it works, and the information that you're getting off of it, right? So you're going to have a basic understanding of cardiac anatomy and physiology, enough to comprehend the next step, which is ECG theory, okay? Without this, it's going to be very, very difficult to understand what's going on in the ECG theory portion of your education. Rhythms, you're probably going to be familiar with primary rhythms and primary dysrhythmias. Conduction, you will probably have superficial knowledge, and I doubt that any progress beyond that will be made. Medications, you will be aware of them. However, placing them in their correct step of action, that's going to be way beyond somebody that's just getting into the game. Electrolyte imbalance, you will probably cover hyperkalemia. Beyond that, no. When it comes to STEMI and unSTEMI, this is something, of course, you're going to have to start learning, but localizing STEMIs and so on and so forth, that's, I would say, way beyond the understanding of a beginner. Now, you will definitely have poor to no understanding of complex dysrhythmias, okay? This stuff gets very, very tricky, and you need to know a lot to discern this properly. Blocks, you will get into what AV blocks are. You will probably be able to pick out a couple of them, but they get pretty tricky. And of course, there's other electrophysiological phenomena, which is extremely complex, and it's typically reserved for very advanced classes. It just never gets covered. And there's a good reason for that, but just understand that there's a lot of other electrophysiological phenomena out there that simply does not get covered, especially in the beginner classes. Now, this is something that I really wanted to emphasize, that I see a lot with beginners. Beginners do not measure. Of course, you take a class and they'll tell you measure this, measure your PR interval, measure the rate, measure so on and so forth, but I rarely ever see beginners measuring. And I would say that that's probably the biggest mistake. Okay, now let's move on to an intermediate. You can kind of see the beginner, right, faded out here. Now this is somebody that knows, and they know what to look for. So this is a huge jump from still learning to somebody that knows. It assumes that you've completed at least a good portion of your training, and that's true. So here, somebody that's an intermediate level interpreter, I would say that they would have to be proficient. They would have to have a comprehensive understanding of cardiac anatomy and physiology. Also, comprehensive understanding of primary rhythms and dysrhythmias. Conduction as well. Electrolyte imbalances, they will probably be familiar with most of them, maybe not all of them, but most of them. Atrioventricular blocks should be fairly easy for you at this point. STEMI and unSTEMI, you need to know what they are, where to suspect them, and how to localize them. Now, this is also somebody that measures, and they measure accurately and they measure frequently. Drugs was so these two categories right here were really the reason why we placed intermediate, why there's such a huge jump from an intermediate to, from a beginner to intermediate. So this level, you're going to be familiar with drugs, medications, right? Cardiac medications. And in this category, you will find, or you should find, emergency medical services. So these guys will have to go out there and make a quick decision on the spot that's probably going to involve drugs or some sort of a treatment. So this is going to be somebody that's going to be administering emergency treatment. So maybe not, extensive, detailed treatment, but emergency treatment. And in order for you to do that, you better be operating at a level where you are proficient in many, many things, okay? Again, no such gradation exists. We're just using this for the purposes of this video. When it comes to intermediates, here's a couple of pitfalls, if you will. They will still have a basic understanding of AV blocks. Now, the blocks can get a lot more complicated, and here we're talking about ECG interpretation. Okay, ECG interpretation, it's not so simple, and you'll see why. So blocks can get very complicated. Complex dysrhythmias, or arrhythmias, call them whatever you like, but sometimes they can get extremely tricky. And that is something that an intermediate level interpreter may or may not be able to discern. Electrophysiological phenomena or electrophysiology phenomena that are present, that the ECG world is built upon, they're tricky, they're complex, they require a lot of education, and that's something that I would say an intermediate level person may or may not be aware of. Okay, now, huge jump, right? From a beginner to an intermediate, huge jump. So essentially, this is somebody that's still learning to somebody that's ready to administer treatment, or at least emergency treatment, right? Huge jump. Of course, you can break this down into smaller steps by all means, but here I'm just trying to illustrate a point, and we're coming to that. Now, when it comes to somebody that says, I'm an advanced ECG interpreter, I would say that they would have to have a multidisciplinary approach, deep fundamental understanding of cardiac anatomy and physiology and general anatomy and physiology. Okay? Medications, they need to know pretty much cold. There's going to be several instruments to interpret in coordination with an ECG. So here we're talking about echo, angio, X-ray, quite a few of them out there. And this is really a category that's reserved for cardiologists and electrophysiologists. Now, other medical degrees with specialization will perform at an advanced level. In fact, some of the best ECG interpreters that I know of, that I've seen, met, interacted with, are emergency medicine physicians. These guys need to act quickly based on results that they're seeing. So oftentimes you will see emergency medicine physicians with extensive specialization or just extensive knowledge, where I would say that they are definitely an advanced ECG interpreter. They're going to be able to confidently assign treatment, interpret complex dysrhythmias, blocks, and they are going to be familiar with other electrophysiology phenomena. Now, the other electrophysiology phenomena, which I'm not going to be going into, is absolutely necessary for you to be termed an advanced ECG interpreter. This stuff is very, very tricky. And finally, the expert. The expert is, I suppose it's pretty easy. This is a very, very advanced level of interpretation, and somebody that's able to interpret with ease and great precision. So you don't expect an expert to hesitate, to second guess themselves. You expect to have a methodological approach that will yield results almost immediately. This is going to be somebody that confidently assigns treatment. And of course, you would expect an expert to be a go-to person for all cardiac ECG phenomena. Okay, so this is a pretty high mountain to climb. But these are the 4 categories we're using to illustrate a point in this video, okay? Again, there's just an overview. Huge jumps, right? You can break this down into 100 steps if you'd like, and call them whatever you'd like. But in general, beginner, still somebody that's learning. Intermediate, you already know, and you know enough to administer medical treatment, so you're familiar with pretty much everything that a beginner is still trying to attain. Advanced, we're talking about multidisciplinary approach. Here, this is really a doctor level assessment, and an expert is just somebody that's advanced with a lot of experience, really. So, a couple of things that are apparent is if you want to be an advanced level ECG interpreter, you're probably going to need med school. Okay. Why? Because this is a multidisciplinary approach. This will make a whole lot more sense if you're maybe angry looking at this. This will make more sense when I show you the example, which is coming up here. Now, before we get to the example, I wanted to show you, if you're confused by this level of gradation, this is something that commonly happens out in the real life. So a beginner will get hired or trained, and then they will have either a well-defined or an implied situation where anything beyond their level of prep or training gets flagged and sent off to somebody that's intermediate, advanced, or an expert. This is pretty common. It happens either because it has to or because it's a good idea for that to happen, in that setting. And this is pretty commonplace. Just be aware of that. Okay. We're going to the example. So looking at the example, we're going to be looking at this example, and if you find yourself to be an expert or an advanced ECG interpreter, pause this video here, try to figure out what's going on here. I am going to keep on going. So if this video, right, we're just going to be looking here at this strip. If you're reading strips, if you're interpreting strips, or if you're looking at a single channel, please understand that it is going to be immensely difficult to interpret what's going on fully with the patient. Okay, here you might be able to get rate, maybe rhythm, okay, but full interpretation is pretty much out of your purview. So a beginner, based on what you've seen in this video thus far, a beginner should be able to take this ECG, take a look at it, and say that the heart rate is roughly 60 beats per minute. Here we're talking about not using any calipers, rulers. They can if they want to, but just by glancing at it, they should be able to tell that the heart rate is roughly 60 beats per minute. They should tell you that the QRS is wide, okay? They should be able to pick up on the right bundle branch block, although bundle branch blocks tend to be a bit tricky for beginners, but they should be able to pick up a right bundle branch block fairly easily. They should also pick up on these T-wave inversions. They're probably not going to understand where this is coming from, but they should be able to pick up on these T-wave inversions. That's a beginner. Now let's take a look at the intermediate level. So an intermediate level person is going to take a look at the heart rate and be a little more precise. And they're going to say, okay, the heart rate is really 62 to 63. Is there a huge difference? Does anybody care? No, but they will be able to discern this just by eyeballing it, okay? They're also going to pick up on the first degree heart block that's present. I didn't really label it here, but if you're familiar with what a first degree heart block is, you can pause this and measure it out. They will be able to tell you that this is a sinus rhythm, where a beginner might be confused by what this is. They might not call this a sinus rhythm. They might just freak out. The QRS is no longer wide. It is extremely wide. And the right bundle branch block has been confirmed. Okay. The T-wave inversions here are acceptable, but these are setting off red flags. This is an intermediate level interpretation. Okay. Extreme right axis deviation has been flagged, right? And according to, well, different criteria, you're picking up that this person has right ventricular hypertrophy, right? Here I used Sokolov-Lyon criteria, but also we have the presence of the pattern S1, S2, S3, right? S1, S2, S3. And the axis is, in this case, greater than 110 degrees. Now, if you're an intermediate level interpreter, you should be able to figure out axis just by looking at your ECG roughly, and you probably are going to be able to get within 10-15 degrees if you have a pen and a piece of paper handy. All right. So let's take a look at the difference, right? Beginner is going to pick up on the rate, a couple of deformities, and probably be a little bit confused. And intermediate is going to be breaking this down quite a bit, and there's going to be a lot more information presented. Now take a look at the advanced level. What just happened? All of the information remained that an intermediate level person took a look at. However, the conclusion was that this is tetralogy of Fallot. Okay, this is a congenital heart defect. You can look up what this is. I think I have this video. If you go to PEKGA YouTube channel, you can find a video on this very ECG. Yeah, take a look at it if you want. Otherwise, you can just look up what tetralogy of Fallot is. It's rather complex, but an advanced level ECG interpreter will be able to pick this up. They should be able to. Now, look at the difference between a beginner and an advanced level, right? See why multidisciplinary approach is necessary. This is something that's simply not taught in beginning classes. So again, this is just a categorization we made up to illustrate a point and to show you how tall this mountain really is. Now, why is there such a huge jump when it comes to expertise levels? Well, first of all, we only used 4 of them, right? If we used 100 of them, there'd probably be small increments, but well, I'll explain that in just a second, but remember, ECG is a skill, right? So reading ECGs is a skill that can be learned relatively quickly. Interpreting ECGs is a science. Okay, here you have to know a lot more, right? Requires dedication, learning, practice. Huge jump, huge difference between the two. And again, interpreting ECGs well is an art form. I love running into people that are great at interpreting ECGs. It really is inspirational. Now, here's the reason for the jumps, okay? Anyone will come across advanced level ECG. So if you're a technician, if you're a nurse, if you're a physician, anyone will come across an advanced level ECG, but not everyone will be able to interpret the results, and even fewer will be able to act upon the findings. Okay, I'll give you a couple examples here. So let's say you're in EMS, right? Their level of prep or training when it comes to ECGs is anything from average to intermediate. Now imagine this scenario. They have a person in the back of the truck, and you're not that well versed, or maybe you are, in ECG interpretation. So you're looking at your ECG strip based on how confident you are in what you're seeing. That's going to affect your medical treatment. Okay, here's another instance. So let's say you pick up a patient, or you get to a scene and the patient is unresponsive, right? Now EMS it's worth mentioning, these guys deal with all sorts of stuff. You show up, you can't park anywhere, maybe the house is on fire. The EMS portion of your experience is going to be the least of your worries, right? But let's say you pick up a patient that's unresponsive, you can't gain insight into personal health information, right? So you hook them up maybe to an ECG, and you can't ask a question. You can't ask a question about what drugs did they take, did they not take. So you're just looking at an ECG. You have to be able to confidently assign treatment, emergency treatment, okay? This is the reason why there's such a huge jump in the categories we assign today. Now, let's say you're a nurse. Nurses will often have either very basic, well, it can really span from basic to intermediate level training, depending on which unit that they're working on. But it is a wide range of ECG prep. ECG findings may change suddenly and unexpectedly. So I'm assuming that, if you're a nurse, you have patients' rooms, right? And there's an ECG hooked up to a patient, and the ECG findings may change suddenly and unexpectedly. Now, sometimes the changes may be benign, yet the alarms may go off. I don't know, maybe the heart rate drops below 60 and the device is set off to designed to set off an alarm if the patient gets bradycardic. If you don't know what happened, if you can't pick that up, you're going to be calling all sorts of personnel to come in, maybe calling a code unnecessarily. Now, sometimes it's far worse than that. Sometimes the change may be life-threatening, but it's subtle. So let's say, I'll give you an example. Let's say the rhythm changed from normal sinus or sinus bradycardia to junctional or accelerated junctional, but the device didn't pick that up, or the alarm didn't go off for that for whatever reason. The QRS might have remained roughly the same, and it didn't trigger one of the alarms. But let's say you were looking at the screen. That is significant. That is significant. Now, ECG techs. Oh boy, I feel for you guys. So ECG techs, I put on here very little to average training. So when I say average, that's a culmination of everything out there. Very little is on here because we still have primarily hospitals or clinics which will offer very little training in order to do this job. And the reasoning for that is they're going to have personnel always around them that they can inquire, ask questions, and so on and so forth. And that's true. And there's also a huge push to get certified day to day. So a lot of technicians out there are going to be getting certifications. And that's fine. But please understand that techs sometimes will get very little training. However, they will deal with an enormous workload. I think they deal with the most ECGs in a single setting. So in a course of 8 hours, an ECG tech will see hundreds, if not thousands, of ECGs. I know it sounds a little bit ridiculous, but it's true. Now, you will see an enormous amount of ECGs. But there's not a filter out there that says, oh, send them only normal sinus and sinus bradycardia. No, you're going to get everything, right? You're also going to be looking at strips. You're probably not going to be looking at a 12-lead ECG analysis. So the patient might be complaining of symptoms. You have no idea why that's happening, right? And this is a bit of a problem when it comes to the tech world. The training tends to be slightly less than what is necessary for this, right? And a lot of things might get missed. Again, we're talking about gradation jumps that we're using for this video, okay? Why we broke it up into such levels. So anyone will come across an advanced level ECG. Not everyone will be able to recognize it. So study, practice, and excel. So what can you do to advance? I hope it's clear to this point why we're having such jumps, right? At an intermediate level, you're able to react upon an ECG. At an advanced level, you'll be able to recognize some pretty intricate stuff, and you'll have a multidisciplinary approach. So either you know how to read an ECG, and you can talk with the person next to you about what's going on, or you don't. It's really that simple. It really is that simple. Okay, so what can you do to advance, right? The more advanced the apparatus, the more precise the information, the more advanced the reader, the more accurate interpretation. What can you do to advance? So back in the day when I first started this, very little. The answer was very little. Today, we have YouTube, we have social media, we have online courses, we have self-paced courses. None of this was available when I was starting out. So you were at the mercy of somebody next to you explaining something to you, picking up a book which may or may not be adequate for what you were dealing with, and of course finding original studies. First of all, it was difficult finding the study itself. What do you look for? What do you search for? And it took an enormous amount of time. You have to go to a library. Maybe you can find it at the library, maybe not. Maybe you have to seek some sort of a medical journal. Maybe that journal came out 20 years ago and you can't find a copy of it. It was a nightmare. It really was. Today, this is much easier. Much easier, okay? And this was not the case, too long ago. What I'm talking about, this change happened in the last 10 years or so. All of this, well, 10, 15, but even YouTube, right? It's been around for a couple of decades now, but in the beginning, it was just weird videos of people doing strange things. Now you have all sorts of stuff. Anyway, let's keep going. So let's say you are a doctor, right? You want to advance in the ECG interpretation, but you don't want to do a specialization. So what can you do? You're probably aware of this, but you can read studies. These are an excellent source, right? There's nothing better. But it requires expertise, and it does require cross-checking. So, you pick up, you read a study, and then you have to search other studies that have either confirmed or denied that study, and so on and so forth. So this takes some time. It requires quite a bit of dedication, really. But there's nothing better. Books. Now, you have an advantage because you can pick up more advanced books, okay? But it does require time, it does require patience. Master courses, I would say that they are an excellent resource. However, they are typically made around somebody who already knows quite a bit about ECGs, and you'll probably be expected to have some sort of experience when it comes to ECG. So it's kind of fun to go to these courses to see the end product. But if you don't deal with ECGs, and there's plenty of physicians who simply don't deal with ECGs. Maybe they see one from time to time, and that's about it. And that's understandable. For those of you who are not physicians and are watching this video, this is a normal thing. This is not something very strange. Okay. Now, if you are a physician and everything I mentioned up here is just too much, you don't know what to pick, you don't want to take a master course, maybe that's a little bit intimidating, well, take a comprehensive course. That's nothing wrong with that, right? Take a comprehensive course, kind of gauge it, evaluate it, see your needs, and take a course. Now, if you're a nurse and you want to advance, again, you can find a book that is specific to your desires. If you don't know what you need, ask somebody on your floor. Okay, so I'm looking to advance in AV blocks or dysrhythmias. What's a good book? Or maybe books, right? Sometimes you might have to get more than one. Of course, it is going to require time. Medical personnel are generally working crazy schedules, so books sometimes are not the best option, but they are a great option in a sense that you will always have a reference guide. So you can always go back and say, hey, let me look up that look up that Mobitz 1, see what it is, how do I find it. Classes are probably a very nice option if you're a nurse. Just make sure you find one that's specific to your desires and your schedule. Courses, look for a well-rounded course. You're going to see a wide range of ECGs. Okay, you're going to see a wide range of ECGs in all sorts of settings, so a well-rounded course might do you a world of good, really. Now, if you're interested in pure ECG interpretation, so you just want to learn about ECGs, any course, fitting your needs or offering a well-rounded ECG experience will do. However, if you're looking to become a little more specialized and you're going to be dealing with a lot of medications being administered to the patient based on ECGs, right? Seek a course that's taught by MDs or somebody with a great deal of experience when it comes to medication. So don't just take any course. Look for something that's a little bit closer to your level of experience. Again, you want to learn basic ECG interpretation or more advanced, any course will do. But if you're looking for interactive medical treatment stuff, really pay attention to this. Okay, now let's say you're an EMS, right, and you want to advance. For you guys, anything goes. I really feel for this category. This is such a strange category to work in. You have to administer medical treatment. You have to be good. You have to be fast. It is a nightmare, right? So books, you can pick up a book, and while you're parked or while you're waiting for a call, if that ever happens, right, you can kind of glance through it. Or maybe if you ever get a day off, you can kind of glance through it. Classes and courses, I would highly recommend these, but you do have to see what they offer and what you need. And the reason I say that is, if you're an emergency medical services person, you will typically seek ways to readily and easily identify complex dysrhythmias, right? You're going to slap on an ECG device, some electrodes on a patient. You're going to get something across your screen. You want to be able to interpret this relatively quickly. So if you're looking for courses, look for courses that will give you a better understanding of AV blocks, discerning wide complex tachycardia, SVT, electrolytes, and of course, STEMI related stuff. Now, let's say you're a technician and you want to advance. Again, this comes up, but it comes up in every single category, and that's really what you have to work with out there. However, I'm discussing it specific to the category, right? So, in your case, if you're a technician, you can pick up some basic books, you can pick up some more advanced books, and you can kind of wrestle your way through them. Okay, you can certainly do that. Now, you're going to be looking at a ton of ECGs, and this might be a little bit overwhelming, might be a little bit confusing. Classes and courses will give you a chance to ask a question, maybe to bring in an ECG and have them explain an ECG. So it's not a bad idea. I would say that this is a much better idea than picking up books. Seek a class that will advance you. So you probably want to know a little bit more, understand a little bit more. So seek a class that will take you from where you're at to the next level, okay? And again, you will see a ton of ECGs. So you're going to need something that's well-rounded, that has some depth, and this will make your life so much easier. I'm going to show you some of the things that happened with students at PEKGA in a few slides here. Now, one thing to avoid, okay? This is very, very important. Do not seek quick fame. So if you're out there and you're looking at a course or a weekend course or something that says master ECGs, become an ECG expert in these 5 steps in 5 days, in 3 days, good luck. Good luck. I can tell you right now, you're probably going to be wasting your money. Remember, Reading ECGs is easy, but ECG interpretation is a science. It requires time, learning, and practice. And reading or interpreting ECGs well, you're not going to be able to do that if somebody shows you 5, 6 different rhythms, maybe even 20 of them. It takes time for the information to settle, to process, to be recalled. That is, that's not something that happens overnight. So do not seek quick fame. I would say the same thing with beginners. Okay, I'm going to start off with that here. If you're a beginner, you can take any route you want. It depends on how much time you have. So if you want to progress slowly, if you're looking at becoming an ECG tech a couple of years down the road, you can start reading books. There's going to be no pressure. You're probably going to be absorbing this information relatively quickly. But again, it's not going to happen overnight. You picked up a book, you don't know anything about ECGs. A month later, you're going to know something. Are you going to be a beginner? Maybe, maybe not. Classes are going to make you progress much, much quicker. Okay, you are going to be looking for a well-rounded course that offers a wide range of ECG phenomena. I repeat, do not seek quick fame. Build a solid foundation. This is true also for a beginner, but what did I say? For a technician and for a beginner. You build a solid foundation, and when I'm talking about solid foundation, I'm talking about the basic blocks: anatomy and physiology. Now, anatomy and physiology, I guess it's worth clarifying. Anatomy deals with structure of the heart. Physiology deals with how that structure functions. Okay, there's also biochemistry involved in ECG interpretation. So make sure you have a solid understanding of how anatomy, physiology, and biochemistry functions. I know that sounds like a lot, but here you're specializing, you're focusing only on the heart, so it's not that much, okay? It still requires you to learn, it still requires you to understand, but if you understand that, you're going to be able to progress so much more quickly. Remember, ECGs is easy, but interpretation is a science. It requires time, it requires learning, it requires practice, and it really does require it. This is not going to, you're not going to go to sleep one night and wake up the next day and you're going to know it. Okay, it requires time, it requires learning, it requires practice. I'm not saying it requires it for you, it requires it for anybody. Okay, so just understand that it will take time, it will take learning, it will take practice. Now, let's talk about PEKGA, right? You guys were nice enough to entertain this video thus far. Let me show you what we do at PEKGA. So, just a reminder of the levels we were looking at, right? Beginner is somebody that's still learning. Intermediate already knows everything that a beginner is learning. Plus, they're here getting into how to do emergency medical treatment. Now, I want to clarify something. Emergency medical treatment is not necessarily taught at an intermediate level ECG class, but the proficiency in understanding what's going on the ECG will allow you to administer emergency medical treatment. That's something I really should have clarified up there in the beginning, but here. Okay, so essentially you're understanding enough to do emergency medical treatment. Now, emergency medical treatment may not be taught in an intermediate class, right? Advanced, this is a multidisciplinary approach, and here we're talking about med school, right? So at PEKGA, what we did, we took information from advanced, expert, and original sources. We put it into a system that is designed to help you advance with measurable progress. Okay, so it's not going to be like you're moving on day to day and you don't know what's going on. You're the same yesterday as you were today. It's designed also to help you absorb and retain information. And this was a key. This really prevented us prevented us is not the right word that I'm looking for, but this is the reason why we did not want to do quick courses. We offer, single classes and so on and so forth, but for somebody that's learning ECGs, you need time for this to absorb and retain, and you need a lot of repetition. So the last thing, well, not the last thing, but one of the other things that we do at PEKGA here is we really work on your confidence. Okay, so being able to point to something on an ECG, great, wonderful, but to do so confidently with understanding of why it is that you're pointing to that, now that makes a world of difference. All right. So when we were putting this together, we really had to think about who are we doing this for what reason, and so on and so forth. And we decided to do it for somebody that knows absolutely nothing. So you might be, I don't know, you might be working on air conditioning equipment and you want to become an ECG technician, right? You might be a school teacher. You don't know anything about ECGs. We designed this course to guide you from nothing to a beginner, ultimately to an intermediate level. And eventually, if you want to, it's not going to be a far stretch when you're done with everything that PEKGA has to offer to jump to an advanced level. It's not going to be a far stretch at all. However, this step does require medical school, right? And the reason why I say that, this is not an inflated statement, is because if you look back, we took our information from the experts, from the advanced, from the original sources, and we intertwined that into everything that we deal with at PEKGA here. So even as a beginner, as a newbie, you're going to get introduced to advanced concepts, which only later through repetition you will be well versed in. We also focus on vector-based analysis and fundamental understanding of what is causing the ECG to take up a certain configuration. So most places out there will focus on pattern recognition. That's okay. It's quick, but you're not going to have understanding of what's happening. We really focus on fundamental understanding of ECGs. Now here's something interesting. I was kind of debating whether to throw this on here because we're still crunching numbers and we're still doing assessments, but this is some of the preliminary information that has come back to us recently. So this is a couple of days old. All right, all of this data together, just preliminary findings. Again, we're still doing analysis, but preliminary findings are showing a 45.5% increase in visual proficiency. So that happens almost immediately. So here we're showing you tips and tricks that will help you identify things on an ECG better. We're showing also a 68.7% comprehensive proficiency. So here people are understanding why they're seeing things on an ECG and exactly what they are. So sometimes they were labeling things wrong, or they simply didn't understand why this was showing up. Those two are tied together, really. So these are immediate. Those are our preliminary findings. I'm going to be posting a more extensive statistical analysis once it's complete, but so far the numbers are actually higher than this. However, I'm confident in these numbers, so I posted these. Now, this is interesting. Our students that have come to PEKGA, our students progress quickly to confident interpreters. And I was surprised by how true this was. I was really kind of nervous when I first started doing this, how true this was going to be, but I was surprised how quickly this happened. Another interesting thing is students that have been to PEKGA are able to engage in conversations at an advanced level. So that intertwining interweaving advanced concepts into our lessons really, really paid off. Now, here's an unexpected thing. We find that we did not ask this. This is something that was reported back to us. So it's an unexpected finding, but there's a great level of increase when it comes to joy and fulfillment at work regarding ECGs. You know, people are feeling a lot more confident, which I'm very, very pleased to hear. Okay. And as a result, there's a significantly better interaction with other medical staff. Again, this is something that really surprised me. I mean, we really worked hard to design courses, to design lessons that will increase both, visual proficiency and comprehensive proficiency. So understanding and recognizing what it is that you're seeing and the results we're getting back, I'm very pleased to say I'm very proud of it. Now again, currently we're undergoing a major statistical analysis, so we're evaluating a lot of stuff at PEKGA, so I'll probably be posting some of that either on the website or maybe I'll do another video. Okay, so what do we offer at PEKGA? So we have one-on-one, we have group sessions, specialty bundles. This is new. I'll be discussing that. CRAT, CCT prep, this is what we started off with, and of course ECG theory. All of our stuff is done online. Okay. Now in one-on-one, let's say you come in and you want to do one-on-one. Choose what you want to talk about. It's a 1-hour session. Pricing is per hour. It can be a single topic, multiple topics. It can be one lesson, several lessons. The very first person that came in to do a one-on-one session had like 20 questions that he wanted to ask, right? The very first question he asked, he thought it was going to be a simple answer, but it actually ended up being a very complex topic. So he ended up asking 5 more subsequent questions related to the first question he asked, and he burnt up his first hour. Now, you know, this guy was really trying to get his money's worth, and you know, that's fine. That I would probably do the same thing. However, please understand that sometimes a simple question requires a complex answer. So, and we have a free session where we'll spend a half an hour with you talking about your needs and make a recommendation. But this guy came in cold, okay? This guy came in cold, so we gave him a session for free and helped him with the other 19 questions. Sorry, it was just a funny. We're still friends, okay? All right, group session. So same thing as one-on-one. This is an hour. Pricing is per hour. We started off with letting 10 to 15 people in the groups, but that turned out to be a nightmare, and not so much for us as much as it was for the group. People ended up arguing over who's going to be asking questions and what questions are going to be asked. So if you're going to do a group session, it's pretty much the same thing as one-on-one, right? Single topic, multiple topic. You can do one or several lessons. You can just do Q&A. You don't have to necessarily pick a single topic, right? But before you come in, if you're going to do a group session, it's best to have specific questions and desires beforehand. So really have a clear outline of what it is that you want to learn as a group. Also, the people that you choose, make sure you have a great deal of understanding amongst yourselves, because sometimes as you're learning things, questions will come up. So for your sake, so you're not arguing amongst yourselves, just have a clear understanding of what it is that you want to learn. and have some questions maybe beforehand. Again, we offer a 30-minute session, so you can come in and say, hey, we want to learn about blocks, but we don't even know where to start. We don't even know how many lessons to expect, and so on and so forth. We'll guide you through the process. You make the decision whether you want to stick with PEKGA or go somewhere else. Completely up to you. Absolutely no forcing. We're not here to force anybody to do anything. Okay. Specialty sessions. Now, this is something that's new, and this arose from these group sessions. So people came in and they wanted to learn about, wide complex tachycardias or blocks or whatever. And then we were like, oh, why not just offer that instead of taking the entire ECG theory? Why not offer that? But it took some time to make some clear cutoffs as far as what people typically want to learn. And here the pricing gets a little bit trickier. We have to see what you want, how long it's going to take, and so on and so forth. But what you can expect in these specialty sessions, again, you choose what you want to talk about, right? What you want to learn. So you're going to be learning about, for example, SVT. We're going to focus on SVT only and concepts that help explain SVT. So it's going to be a single topic, if you will. Of course, you can do multiple sessions, right? But expect this to be multiple session right off the bat. And in the format we run this in is the same as our coursework. You're going to have 90 minutes per session. So in one session, you might have 1 or 2 lessons or modules. And then there's going to be 90 minutes worth of discussion. You will have homework. Homework is not mandatory. It's something that's assigned for you to help you progress, okay? And it will be for everybody in the team. So let's say, a group comes in, or maybe it's just a single person, doesn't matter. But your homework is there to help you think about what you just learned. And there's going to be an exam. So the exam is for the specialty lesson, just to gauge your progress and also to give us feedback. ECG theory, this was really a natural-born component of CCT CRAT prep. And this is pre-designed, okay? And everything else you choose, thus far you choose. This is pre-designed, so you come in for 4 to 5 weeks. It's a course. It's a 90-90 lecture discussion format, so 90 minutes lecture, 90 minutes discussion. Discussion is optional, okay? I mean, everything is optional, right? But nobody's going to force you to do this, but the lecture is really the information from us to you. The discussion is you asking to clarify what's not clear to you. So we're spending 3 hours a day. If you want to go that far, again, optional, and you can stay for 9 minutes, you can stay for 90 minutes, up to you. There's 40 plus modules. I think it's 45 or 47. Okay, so yeah, there's 40 plus modules. It's going to take 4 to 5 weeks. There's homework per module. You will get homework. So one module is one lesson. And sometimes in a lecture of 90 minutes, we'll cover more than one module, all right? So you will get homework, one set of homework or one homework assignment per module. Exams for ECG theory, 2 of them, and there's also weekly review. So again, we really focus on building your confidence. So there's a lot of time being given to discuss this, to think about ideas, to come back the next day, to keep on thinking about these ideas, to really get comfortable looking at and dealing with ECGs. All in all, you're really looking at 60 plus hours in total when it comes to this course. So this is not something that's quick. It's not going to happen over the weekend, and it does take time. And finally, CCT-CRAT prep. Now, this was what we originally started with, and we were really thinking about, what kind of folks are looking for this, and the answer was really, really wide, right? There was a wide range of folks that were looking for CCT-CRAT prep. So we designed it that we started designing it for ESL students, which proved to be a little bit challenging, but not impossible. So our coursework was really designed for very, very little to absolutely no understanding of, anatomy and physiology and what an ECG is. This is a 6 to 7 week course, right? It's a 90-90 format, lecture, discussion, so 90 minutes of lecture, 90 minutes of discussion after the lecture. There's 60, I think there's 65 or 66 modules on this one. So 60 plus modules. Again, one module is one lesson. You may have more than one lesson, and most of the sessions that we have, you'll have more than one module per lecture. Anatomy and physiology is the difference here when it comes to ECG theory, right? So here we have anatomy and physiology. You also get homework, one homework assignment per one module. There's 3 exams. So 1, 2, 3, right? 3 exams when it comes to CCT-CRAT prep. And the exams are pretty extensive. So the exams are designed to mimic what you would expect to see on CCT-CRAT. Not all of them are the same. Okay, this is extensive. Once you're done with this course, your CCT-CRAT prep is going to seem like a joke, really. And then we also leave time for weekly reviews. So typically we meet 5 days a week. I should have put that on here, but we meet 5 days a week, and we leave one other day during the week for review. So maybe you had to miss a class, maybe you're not understanding a concept as well as you should. Maybe you read something somewhere in the meantime that's confusing you. So we will leave a weekly review. Typically we agree on this. So the entire class will agree on this. When should we hold it and for how long? So far it has happened on the 6th day of the week, whatever that may be. And it typically lasts anywhere from 1 to 3, 4 hours. I'm typically there to hold those and discuss anything, and really anything that you want to discuss. This in total turns out to be more than 90 hours in total. Okay. We also worked initially on work prep and application prep, and we'll still do that today, but it's no longer designed into the coursework. So this is optional. We don't charge anything extra for this, but we'll help you with your application and your work prep. If you're, some people come in here, they just need to get certified. They already work. They could care less about this. Other folks are looking to apply for the first time, so we'll help them with the whole process. Now, enrolling in a course or class. So this is something that hopefully some of this stuff that I showed you for PEKGA, maybe you don't have to ask this, but this is good to understand for yourself. Okay, so if you want to enroll in a course or a class, what do? First of all, understand what your end goal is. So what are you in this for? Are you looking to become a tech, a physician, a nurse? You just want some basic understanding? You want some very specific understanding? Make sure you answer that for yourself. Okay, that's going to help you pick a course. Understand what you will need to succeed. Now, you're getting into this for the first time. You don't even know what is required of an ECG technician. So out there, anywhere, try to find out what an ECG interpretation, what an ECG tech needs, but what ECG interpretation requires. Magnifying glass, calipers, some basic understanding. And these are things that will help you, that will aid you on your road to success, right? How much time is required? How much study is required? Also, take a look at that. So you might pick a course and you're like, all right, the course is going to do everything for me. I just need to show up. That's not the case. So please understand that you will be required to study and dedicate time to this. Now, you can always come and ask us. We offer a 30-minute session to anybody for any reason. We don't bite. We're people just like you. We stumbled a lot to get to where we are. A lot, okay? A lot. And we used all of that to kind of polish our system. So our motto is, our mission is you, our goal is your success. Our mission is you, okay? We're here to make you better at ECG interpretation, and we really want to make you succeed. We want to make you successful. That's really the only advertising we do. So far, it's been word to mouth, and anybody that's walked out of here has typically brought somebody else back. So we wish you all the best in all your ECG endeavors. I hope this video was useful in understanding at least something when it comes to doing ECGs and what it requires, what it takes. If nothing at all, it has made you think a little bit about the ECG world. Again, have any questions, feel free to go to our site, send us an email. We'll set up a time. We'll answer any and all questions that we can. If we can't help you, we'll point you in the direction where somebody is probably going to be able to help you. Again, all the best, and we'll see you next week on the next video.